Have you ever wondered how your body changes as you age, especially when it comes to sexual health? If you're over 65, you may notice some shifts in how your body responds, and that includes masturbation. But here's the good news. Sexual health doesn't have to decline with age. In fact, by paying attention to your body's signals and adjusting your habits, you can continue to enjoy a fulfilling and pleasurable sexual life well into your later years. In this video, we'll walk you through the key things you should keep in mind to protect your heart, hormones, and overall well-being while engaging in masturbation after 65. From understanding the physical changes like reduced sensitivity and lubrication to recognizing the impact of medications on your sexual function, we'll share practical advice for navigating these changes. Additionally, we'll explore the importance of mental and emotional health and how stress or emotional fatigue can affect your experiences. By the end of this video, you'll have a better understanding of how to listen to your body's signals, make adjustments as needed, and continue to enjoy healthy, satisfying intimacy. So let's dive in and ensure that sexual health remains a positive part of your life as you age. 1. Pay attention to your heart health. As we age, our heart undergoes several changes. After 65, it's important to pay particular attention to heart health, especially during activities like masturbation. This is because sexual arousal and orgasm can cause a temporary spike in heart rate, blood pressure, and even breathing patterns. For many healthy individuals, this isn't a problem. However, for those with pre-existing cardiovascular conditions, this natural increase in heart activity could put unnecessary strain on the heart, especially if the person has hypertension, arrhythmias, or other heart-related issues. During arousal, the body releases certain hormones like adrenaline and cortisol. These hormones trigger the fight-or-flight response, increasing the heart's workload. As blood vessels dilate to allow for increased blood flow to the genitals, the heart must pump blood more efficiently and at a higher rate. In a healthy heart, this is typically well managed. But for individuals with weakened heart function or existing cardiovascular disease, the increased demand on the heart could cause complications. Some might experience symptoms like chest pain, dizziness, shortness of breath, or even palpitations. For those with heart conditions, these physiological responses can exacerbate existing issues. For example, someone with high blood pressure might find that their blood pressure increases to dangerous levels during arousal or orgasm, potentially leading to a hypertensive crisis. Similarly, individuals with arrhythmias or irregular heart rhythms may notice that their heart rate becomes erratic, which could lead to further complications. Recognizing the potential risks is important, but that doesn't mean people over 65 should avoid sexual activity entirely. The key is moderation and mindfulness. Rather than rushing or engaging in overly intense stimulation, it's better to approach the activity with a gentle pace, allowing the body time to adjust. A slower, more controlled rhythm minimizes the strain on the heart while still providing the physical and emotional benefits of sexual pleasure. It's also important to manage your overall health. Individuals with heart conditions should keep track of their blood pressure and cholesterol levels and prioritize regular checkups with their healthcare providers. If someone has experienced a recent heart issue or feels uncertain about their cardiovascular health, it's advisable to consult with a doctor before engaging in sexual activity. They can provide personalized guidance on how to safely enjoy these experiences while keeping the heart's health in mind. For those without heart conditions, it's still important to listen to the body. If you notice unusual sensations like chest discomfort or feeling lightheaded during or after sexual activity, it's crucial to stop and seek medical advice. While sexual activity can be a safe and natural part of life, knowing when your body is signaling for a break is just as important as knowing how to proceed safely. The overall takeaway is that while sexual activity, including masturbation, is generally safe and healthy, it's crucial to be mindful of the physical and physiological changes that occur as we age. By understanding how the heart responds to sexual stimulation and adjusting your approach accordingly, you can continue enjoying a fulfilling and safe sexual life well into your later years. Always prioritize your heart's health, and don't hesitate to seek professional guidance if you have concerns about engaging in sexual activity. 2. Be cautious with hormone-affecting substances. The body's hormone levels naturally fluctuate, and this can affect various aspects of our physical and emotional well-being. After 65, it's essential to be mindful of substances that could potentially disrupt your hormone balance, especially when engaging in activities like masturbation. Certain external factors, such as supplements, medications, and even lifestyle choices, can influence the way your hormones function, which in turn impacts sexual health and overall body regulation. One common substance that many older adults may turn to is testosterone supplements or boosters, often used to combat symptoms of aging such as fatigue, reduced libido, or muscle loss. While testosterone plays a crucial role in sexual desire and energy, especially in men, it's important to understand that supplementing with synthetic testosterone without medical supervision can be problematic. The body's natural production of hormones decreases with age, but introducing external sources of testosterone can suppress the body's ability to produce its own, leading to long-term dependency on the hormone. This can create a feedback loop where the body becomes reliant on the synthetic substance, and eventually, this can lead to negative side effects such as a decrease in testicular size, fertility issues, or even mood swings. Another substance many people turn to are erectile dysfunction, ED medications, such as sildenafil, Viagra, or tadalafil, Cialis. These drugs are effective at temporarily improving blood flow to the genitals, which can aid in achieving and maintaining an erection. However, while they may provide a solution for some, they can also impact the body's natural responses to sexual stimuli. For instance, these medications may cause a temporary spike in blood pressure or heart rate, and for individuals with underlying cardiovascular conditions, this could pose health risks. Furthermore, long-term use without medical oversight can lead to dependence, where the body feels unable to perform sexually without the medication. Beyond prescription medications, over-the-counter products marketed as sexual enhancers or supplements designed to boost libido can also have unintended consequences on your hormonal health. Many of these products are not regulated by health authorities and may contain unlisted ingredients that disrupt hormone balance. For example, substances like herbal testosterone boosters or stimulants can lead to fluctuating hormone levels, causing mood changes, anxiety, or even contributing to issues like erectile dysfunction due to overstimulation of the body's hormone pathways. Some products, while marketed to increase libido, may instead cause the body to go into overdrive, interfering with the natural rhythms of hormone production. Even something seemingly harmless like alcohol can have a significant impact on hormone levels. While alcohol may initially lower inhibitions and promote relaxation, it also acts as a depressant. Over time, excessive alcohol consumption can suppress the production of key hormones like testosterone and estrogen, leading to lower libido and diminished sexual function. Furthermore, alcohol can lead to dehydration, which affects the body's ability to regulate temperature and fluid balance, further compounding potential issues related to sexual health. Similarly, recreational drugs such as marijuana or cocaine, while sometimes used for relaxation or pleasure, can have a profound impact on the endocrine system. Marijuana, for example, has been shown to lower testosterone levels when used frequently, and long-term use can lead to erectile dysfunction in men. Cocaine and other stimulant drugs can lead to hormone imbalances by overactivating the body's stress response, raising cortisol levels and negatively affecting both libido and sexual performance. As we age, it becomes increasingly important to make informed choices about what we put into our bodies, particularly substances that can alter our hormonal balance. The best way to approach hormone-affecting substances is with caution and awareness. Before turning to any form of hormone therapy or supplementation, it's crucial to consult a healthcare provider. A doctor can assess your current hormone levels and provide guidance on whether any treatments are necessary, ensuring that you don't inadvertently disrupt your body's natural processes. 3. Maintain proper hygiene and prostate care. Maintaining proper hygiene and taking care of our prostate become increasingly important for overall health and well-being. After 65, the body's ability to naturally regulate various functions can decline, and this includes sexual and reproductive health. Prostate health is particularly crucial as the prostate gland is responsible for producing a significant portion of the fluid in semen. As men age, the prostate undergoes changes, some of which can impact sexual health and function. Prostate problems such as benign prostatic hyperplasia, BPH, prostate inflammation, or even prostate cancer become more common with age. Therefore, taking proactive steps to ensure proper hygiene and caring for the prostate is essential, particularly when engaging in activities like masturbation. First and foremost, practicing good hygiene is key to preventing infections and maintaining overall genital health. The genital area is particularly susceptible to bacterial infections, especially if one has a weakened immune system, which can become more common with age. Not cleaning the genital area properly before and after sexual activity can result in the buildup of bacteria, which may lead to urinary tract infections, UTIs, or other complications. For those with a foreskin, it's especially important to gently pull it back and clean underneath to remove any smegma, which can accumulate and cause irritation or infection if left unaddressed. For men over 65, ensuring that the penis, scrotum, and perineum, the area between the anus and scrotum, are cleaned thoroughly and regularly can reduce the risk of infections. This is particularly relevant if the person is sexually active or masturbating frequently. Using mild, unscented soap and warm water is generally sufficient to maintain hygiene without irritating sensitive skin. Avoiding harsh soaps or fragrances is important, as these can cause dryness or skin irritation, which can make the area more prone to infections. In addition to genital hygiene, prostate care is equally important. The prostate naturally enlarges with age, a condition known as benign prostatic hyperplasia, BPH. BPH can cause symptoms such as difficulty urinating, frequent nighttime urination, or a weak urine stream. While BPH is not cancerous, it can be uncomfortable and affect quality of life. Therefore, it's important to be aware of any changes in urinary habits, as this could indicate potential prostate problems. If such symptoms arise, it is crucial to seek medical advice to rule out any underlying issues, including infections or more serious conditions like prostate cancer. Regular checkups with a healthcare provider are essential for monitoring prostate health. Doctors may recommend screenings such as a digital rectal exam, DRE, or prostate-specific antigen, PSA, blood tests to check for any signs of prostate abnormalities. For men over 65, these screenings should become a part of routine medical care, even if symptoms like urinary problems are not immediately noticeable. Alongside regular checkups, lifestyle choices play a significant role in maintaining prostate health. Staying physically active, eating a balanced diet rich in antioxidants, vitamins, and minerals, and avoiding excessive alcohol and tobacco use can help support prostate health. A diet high in fruits, vegetables, whole grains, and lean proteins is essential for overall health, and certain foods may specifically benefit prostate health. For example, tomatoes, which are high in lycopene, a powerful antioxidant, may help lower the risk of prostate cancer. Additionally, omega-3 fatty acids, found in fish like salmon, may help reduce inflammation and support prostate health. One of the key aspects of prostate care is regular ejaculation, whether through sexual intercourse or masturbation. Ejaculation can help to flush out potentially harmful substances and reduce the risk of prostate issues like prostatitis, inflammation of the prostate. Regular sexual activity, or masturbation, has been shown to help maintain a healthy prostate by stimulating blood flow to the area and reducing the risk of prostate stagnation. However, it's important to approach masturbation with mindfulness, especially as you age. Prostate health can be influenced by frequency and intensity. Overexertion or excessive pressure during masturbation, especially if performed in a hurried or aggressive manner, can lead to discomfort or strain. It's advisable to approach the activity with care, using gentle stimulation, and ensuring that the body remains relaxed to avoid unnecessary pressure on the prostate. 4. Let go of shame and isolation. It's common to experience shifts in how we perceive ourselves, especially regarding our sexual health and desires. For individuals over 65, one of the most significant barriers to enjoying a fulfilling and healthy sexual life, including activities like masturbation, is the feeling of shame and isolation. These emotional barriers can arise due to societal expectations, personal beliefs, or changes in physical health. Overcoming these challenges is crucial to maintaining mental, emotional, and physical well-being. Letting go of shame and isolation is not just about embracing one's sexuality, but also about accepting the natural changes that come with aging and finding ways to thrive in this stage of life. Shame around sexual activity, including masturbation, is often deeply ingrained and can stem from various sources. Many older adults, particularly those who grew up in more conservative environments, may have internalized messages that sexuality is something to be ashamed of, especially in later life. Society has often portrayed sexuality as a young person's domain, and aging individuals are sometimes depicted as sexually inactive or uninterested. This can create a sense of isolation and guilt, even when engaging in completely normal and healthy activities. For many, these feelings are exacerbated by changes in the body, such as decreased libido, erectile dysfunction, or other physical limitations. These changes can cause individuals to feel unattractive, less masculine or feminine, or disconnected from their sexual identity. However, it is important to understand that sexuality does not diminish with age, it simply evolves. Just because someone is older doesn't mean their sexual desires or the desire for intimacy vanish. Masturbation, in particular, is a perfectly natural and healthy expression of sexuality, even as the body ages. It can help individuals maintain sexual health, release stress, and improve mood. Yet the stigma surrounding older adults engaging in sexual activity is pervasive and often leads to unnecessary guilt or embarrassment. The first step in letting go of shame is acknowledging that these feelings are learned and not inherent truths. The human body is designed to experience pleasure, and this doesn't end with age. There is no set age at which sexuality becomes irrelevant. Everyone deserves the right to experience intimacy, whether through a partner or alone, and should not feel embarrassed or ashamed of these desires. Reframing one's thoughts about sexuality and aging can help eliminate the negative connotations associated with it. Another significant aspect of overcoming shame is breaking free from the isolation that can come with age. As people get older, they often experience the loss of partners, friends, or social connections, leading to feelings of loneliness and disconnection. Isolation can make it harder to talk openly about sexual health, desires, or the challenges of aging. It can also contribute to feelings of shame, as individuals may feel as though their sexuality is no longer valued or relevant. However, connecting with others who share similar experiences can help diminish these feelings. Support groups, therapy, or even open conversations with trusted friends or partners can create safe spaces to talk about sexual health and desires. These discussions can help normalize sexual activity at any age, making individuals feel less isolated and more empowered to embrace their sexuality. In some cases, older adults may also feel ashamed due to their physical limitations. For instance, erectile dysfunction, decreased sensitivity, or other age-related changes in sexual function can contribute to feelings of inadequacy. However, it is essential to understand that these changes are natural and happen to most people as they age. They do not diminish one's worth or the ability to enjoy intimate experiences. Medical interventions such as medications, therapies, or even devices designed to aid in sexual function can help alleviate some of the physical challenges that accompany aging. These options should be explored in consultation with a healthcare provider, and there should be no shame in seeking assistance. 5. Listen closely to your body's signals. It becomes increasingly important to listen closely to our body signals, especially when it comes to activities like masturbation. Our physical and emotional states evolve over time, and what worked for us in our younger years may not be the same as we get older. Being attentive to the changes in our body and adjusting accordingly ensures that sexual health remains positive and safe. One of the first things to consider as we age is the natural changes that occur in our bodies. For example, older adults may experience decreased sensitivity, particularly in the genital area. The skin becomes thinner and less elastic, which means that too much friction or pressure during masturbation could lead to irritation or discomfort. Being mindful of the intensity of the activity and adjusting the pressure accordingly can help prevent any unnecessary soreness or injury. Erectile function is another area where older adults may notice changes. As men age, testosterone levels naturally decline, which can affect libido and the ability to achieve or maintain an erection. Similarly, women may experience a decrease in vaginal lubrication, which can lead to dryness and discomfort during masturbation. These changes don't mean that sexual activity is no longer possible. Rather, it's important to acknowledge these changes and make adjustments. Using a lubricant can help alleviate dryness and improve comfort, while taking things slow can ensure a more pleasant experience. If erectile dysfunction becomes a concern, seeking advice from a healthcare provider can help find solutions that improve sexual function, such as medications or therapies. Another vital consideration is taking breaks and listening to physical fatigue. Overstimulation or excessive masturbation without giving your body time to recover can lead to soreness or exhaustion, particularly for older adults. It's important to understand your body's limits and avoid overdoing it. When you begin to feel tired or uncomfortable, taking a pause and giving your body time to rest is essential. This will help maintain energy levels and ensure that sexual activity remains enjoyable rather than becoming a strain. Mental and emotional well-being also play a significant role in how we experience sexual activity. Just as physical fatigue can affect the body, emotional stress can influence our desire and enjoyment. If you're feeling anxious, overwhelmed, or disconnected, it can be harder to focus on the present moment or enjoy the experience. Taking time to manage stress and practice relaxation techniques can help clear your mind and make sexual experiences more fulfilling. Engaging in self-care like mindfulness or even a simple breathing exercise can help bring your focus back to your body and enhance the pleasure you derive from the experience. Medications can also impact sexual health, especially as we age. Many common medications, such as those for high blood pressure, depression, or diabetes, can have side effects that affect libido or sexual function. It's important to be aware of these potential side effects and communicate with a healthcare provider about any concerns. If a medication is negatively impacting sexual health, there may be alternatives or adjustments that can help mitigate the effects. It's crucial not to ignore these changes and to seek help when necessary. In conclusion, as we age, it's important to understand and embrace the changes that come with our bodies, particularly when it comes to sexual health. Listening closely to your body's signals during masturbation after 65 can help you adapt and continue enjoying a healthy, pleasurable experience. By paying attention to heart health, being cautious with hormone-affecting substances, maintaining proper hygiene, addressing emotional well-being, and respecting physical limits, you can ensure that sexual health remains a fulfilling part of your life. Remember, these changes are natural, and adjusting your habits to accommodate them will allow you to continue enjoying intimacy without discomfort or risk. Never forget that your body's signals are your guide. By respecting them, you can keep sexual activity safe, enjoyable, and aligned with your overall well-being. Aging doesn't mean the end of a satisfying sexual life. It simply means understanding how to care for yourself in new ways.